Hello, everyone, and welcome back. So, today we'll be speaking about the patient consultation form or your client consultation form. So, it's your first job. This is the first time that you in the industry now. They've given you the opportunity to be the therapist and to be part of the team. So now your client comes and you see the consultation form. Make sure you read that consultation form. Be it your first-time client, be it a patient that has been there before, or a client that has been there before, longer years than what you have been working, it's okay. Read through it. Make sure you know her name, her surname well, her age, demographically where she's situated. Is she living in the Atlantic seaboard? Is she living in Paarl? Know demographically where she's situated, because this is of vital importance for you as a skincare therapist and even as a massage therapist, just as a therapist in general. So whether you at the reception area and your client enters, or you in a hotel spa environment and you have to go fetch your client within the waiting area, make sure you've read that client card now and you've gained all information needed to basically address your client according to her first and last name. And she will tell you how to be addressed, so you can ask her, whichever way suits you best. Really doesn't matter, but you need to display confidence and you need to shake a firm hand and look her in the eye as you introduce yourself, saying, "Good morning, Mrs. Smith. I'm Megan and I'll be your skincare therapist today." So remember that not everyone goes to a spa environment or goes to a clinic environment, an aesthetic clinic, etc. So that's why you need to check your client card to know, has your client been here before or hasn't she been here before? Don't assume, never assume anything. You always make sure. The other thing that you also need to understand and to know is that from your consultation card, you gain your client's age, you gain your client's health, you gain your client's demographically where they're situated. Because if your client's living in Paarl or if she's living in the Atlantic seaboard, that's contributing environmental factors, and it's things you need to know. So from all of that, for example, you could even just look at your client's consultation card and gain already, okay, so what am I going to take from this information to use as a tool if she don't give me what her needs are? Could be relaxing. Yes, that's perfect. So you make sure she gets that relaxation. That is her need. Relaxation is her need. But you as a skincare professional or a massage therapist or any therapist within your treatment room, you are here to make money. This is your business. This is where I am the business lady. This is my room, this is my business, and I need to make money as well. So from that said, you need to also understand where you're going with what you want to do for that. So we'll take the first thing usually that kicks up on a client card, and it's the age. So the client says she's 56 and she lives in the Atlantic seaboard. So you see all this information. You ask her what's her need, and she says she needs a deep cleanse. Okay? She feels her skin is taut, she feels her skin is always dry and it's winter and she needs a deep cleanse. Your alarm bells need to go off, but you need to breathe and be calm about this and not overthink it. So the first question that you pose is, when last did you scrub? Because as we know, as we age as females, hormones causes our natural sloughing off of our skin, our natural process of skin cell turnover to be longer than 28 days when we were a 13-year-old girl. So we need to gather, okay, she's 56, she's probably premenopausal, so now hormones are out of balance. So that causes the disruption of the renewal of the skin cells. So what we need to do is we then obviously need to make sure that when she leaves today, after I scrubbed her skin using a peel, because she wants a peel, she wants a deep cleanse. So it's going to be a peel. It's going to be something that has acids that's going to help break down the protein bonds. So all of this being said, she needs to understand that this one treatment that she spends for once every 4 weeks or 6 weeks, however her budget allows, that's not going to help. And you have to emphasize that. So you have to explain, why do we use a scrub? Because what are we trying to achieve? Why are we doing the scrub? When do we incorporate the scrub? And please do not tell patients or clients that they're damaging their skin. That's not true. That's false. That is so false. You can't damage your skin getting rid of dead skin. That's impossible. That's virtually impossible. I want that to be proven to me, that a client that walks past me and I scrub my skin every day is going to see a micro scratch on my face. That's exactly what we've been taught, you know. That's exactly what's been said. So what we need to do is we need to make sure that we know what we're talking about. No matter who says what, we've studied, we know what we need to do, we know what we're doing in this treatment room, and we need to go accordingly. Because how you will get your client to be satisfied, you need to satisfy her need. Always make sure there's a need to be satisfied. So if there's no need and she's there because she wants to relax and just lay down, then you have to almost gather the information to create the need, if you understand what I'm saying. And I will definitely educate you much more in more videos and take it step by step for you to understand the crucial part of a client card that seems so insignificant. When someone's coming to you and saying, oh no, I'm just here to relax. I need to do a scrub on our hands just to check. We do a scrub on the one side and we don't scrub on the other side. You can see the difference immediately, okay? So what does that tell you? Every day our skin cells die. They are living cells that move up from the dermis that dies. But the process is then obviously delayed with age, with environmental factors, with health, with maybe smoking, drinking, whatever, partying, not sleeping. So then what happens is we have to obviously assist that process. And if your patient's applying expensive ingredients on her skin with serums and all these expensive products that have so much active ingredients, she's just putting it on dead skin if she's not scrubbing. So I hope this has helped you to just think a little bit. I just want to get you in your brain just to think a bit and just to help you to understand that it's something as simple as a scrub that you could sell to everyone, no matter the age, no matter the condition. You could sell it, but you also need to understand that you need to educate your client on why. So I took the 56-year-old, but versus a teenager, you know, their skins are disrupted with oil, but you know what? Their skin also is producing so much oil because of everything becoming active. So with them, you'll use a scrub that's mechanical, that's less abrasive in the sense of maybe opening up the pustules and so on, but they will scrub. Whether it be a chemical scrub or mechanical and chemical, they would need to scrub as well. Yes, their skin sloughs off quicker than the 56-year-old, but the build-up is faster. So again, a scrub you can sell to anyone. And I'm using the word sell because I'm not going to say recommended. I'm going to say sell, because we're in the business of making money. We need to make money also. So we need to educate and we need to sell. Those two go together. No education, no selling. It's as plain as that. I hope you enjoyed that video. It's something very small. It's something very easy to remember, but it's just something I wanted you to think about. Just to take it a bit further and think about how you break down protein bonds, and you break down protein bonds with acids. So I want you to comment in the video below, what acids do we use to break down oil and protein? And what acids would we use for a 56-year-old to break down her protein? And to, you know, things like that. I want you to think out of the box a bit. And I want to help. So I need to know where we're going, what we're doing, at what point we are in our lives as therapists, to understand, should I go a bit more lower than this or should I go a bit more deeper than this? I don't know. I need to know in the comment section down below what you would like to hear. And what I would gain from you is also to tell me where you're from, which city, which province, where you're from, and we can just connect, knowing, are you close, are you in Cape Town, Joburg, wherever, what we can do to just make things a bit more intense, if I might say, more educational, or how I might approach it for you so that I can understand where's your mind at. Because remember, I'm also learning to engage this platform from a point of helping first time into the industry, and also maybe your first year, you just started a job, or even you've just finished your studies. I need to know where and who I'm speaking to understand which content I can create for you to help you as we journey through this. Thank you very much for watching and hope to see you next time. Bye.